Welcome to Nurse Ally, your trusted ally for health and wellness insights. I'm Gabe, a clinical nurse specialist, and my mission is to make healthcare topics easier to understand. Today, we're talking about an important part of your health journey: what to do after you've been discharged from the hospital. Discharge day is exciting, but it can also feel overwhelming. The good news is that you're not alone. I'll share simple, practical steps to make sure your transition home is smooth and successful. Discharge day marks an important step in your recovery journey. As you prepare to leave the hospital, it's essential to have the tools and knowledge to stay healthy and avoid complications at home. This guide is designed to help you confidently manage your care, including understanding your medications, follow up appointments, lifestyle adjustments, and warning signs to watch for. Your healthcare team is here to support you, but you play the most critical role in your healing process. By following the steps in this guide, you'll be better prepared for a safe and successful recovery. This topic is broken down into four sections. In section one, we will be discussing the basics of understanding your discharge instructions. Let's face it, being in the hospital is stressful enough, and when it's time to head home, you're handed a stack of papers that can feel overwhelming. But don't worry, I'm here to break it all down for you, step by step, so you can leave feeling confident and prepared. We'll talk about what discharge instructions are, why they're important, and how to use them to take charge of your recovery at home. Whether it's managing medications, following up appointments, or knowing what symptoms to watch for, I've got you covered. So grab your discharge packet, get comfortable, and let's make sure you're set up for success. Ready? Let's jump in. First, take a look at the medication list included in your discharge packet. This list will usually tell you three important things: what medication you're taking, how much you need to take, and when you should take it. So here's a tip: highlight or circle the medications that are new or have changed. This will help you focus on what's different from your usual routine. Understanding what each medication does is vital for managing your health. Familiarize yourself with the name of each medication and what it's for. For example, lisinopril is for controlling blood pressure. Note the time of day, whether it should be taken with food, and any specific instructions such as take 30 minutes before meals. Understand the correct amount to take and never adjust it without consulting your doctor. An example: take 5 milligram tablet 2 times a day. Also, take note of if the medication is as needed, if you have to take it until you see your primary doctor, or if this is a long term medication. Knowing these details helps you take them correctly and prevents errors or complications. If you have any questions, always ask your healthcare provider before leaving the hospital. Consistency is key to medication adherence. Take your medications at the same time every day and to ensure their effectiveness. Use tools like a pill organizer or smartphone reminders to stay on track. Keep a clear schedule or chart of your medications. It can make it easier to follow your routine and avoid missing doses. Keep a journal of how you feel after taking medications and report any concerning symptoms to your provider. Mistakes with medications can lead to setbacks in your recovery. Double check labels before taking any medication and be cautious with over the counter drugs, as they may interact with your prescriptions. Always consult your healthcare provider if you're concerned about adding anything new to your routine. Even if you're feeling better, continuing your medications as prescribed is crucial to prevent setbacks or complications. It's also important to be aware of potential side effects from your medications. While some mild symptoms are normal, serious reactions like swelling or difficulty breathing require immediate medical attention. Keep the information leaflet from your medications handy and contact your provider with any concerns. Running out of medication can disrupt your recovery, So plan ahead to refill prescriptions before they're empty and consider setting reminders for yourself. This ensures you don't miss critical doses that could impact your health. Proper storage and disposal of medications keep you and your household safe. Store them in a cool, dry place or as directed, and dispose of unused or expired medications through safe methods like pharmacy drop off programs. And never hesitate to ask questions about your medications, whether it's about missed doses, potential food or drug interactions, or alternative options. Your healthcare team is there to support you. So, clear communication can prevent confusion and help you feel confident about your treatment plan. Your follow up appointments are a vital part of your recovery process. This, these visits help your healthcare team monitor your progress, address any concerns, and adjust your treatment plan as needed. Staying proactive about attending and preparing for these appointments can make a significant difference in your long term health. Here's how to manage your follow ups effectively. Follow up appointments are more than just routine visits. They are opportunities for your healthcare team to evaluate your recovery and ensure everything is progressing as planned. During these visits, your provider may monitor how well you are healing, assess the effectiveness of your medications or treatments, and also identify any early signs of complications. These appointments also allow for necessary adjustments to your care plan, making sure it fits your current needs. Before leaving the hospital, confirm all your follow up appointments with your care team. If you don't have specific dates, ask for a list of providers to contact and arrange your visits promptly. Knowing the date, time, and location of each appointment helps you stay organized and ensures you won't miss critical opportunities to discuss your progress. Preparation can make your follow up visits more productive. Before each appointment, write down any questions or concerns you want to address. Keep a detailed list of the medications you are taking, including the dosages, and make note of any changes in your symptoms or overall health. Sharing this information with your provider ensures they have a clear picture of your recovery. Even if you're feeling better, it's important to attend all your follow up visits. Many health issues, such as infections or delayed healing, may not show symptoms initially, but can be detected during these checkups. Missing appointments could lead to undetected complications and setbacks in your recovery. If attending an in person visit is difficult, ask your healthcare team about telehealth options. Virtual or phone appointments allow you to stay connected with your provider without the need to travel. These options are especially useful for discussing minor concerns, reviewing test results, or asking questions about your recovery plan. If you're working with multiple specialists, such as a cardiologist or physical therapist, coordinating your appointments is essential. Overlapping schedules can be stressful and inefficient. Discuss your care plan with your primary provider to ensure all your specialists are aligned and working together to support your recovery. Keeping track of your follow up appointments is easier with the right tools. Use a calendar, an app, or notebook to record all your appointment details and set reminders. Documenting the outcomes of each visit can also help you track your progress and stay engaged in your care. Sometimes new or worsening symptoms may arise before your next scheduled visit. It's important to know when to seek immediate medical attention rather than waiting for your follow up. Contact your provider right away if you experience severe pain, swelling, difficulty breathing, or other concerning symptoms. Section 2 will cover creating a structured recovery routine for yourself. This is a cornerstone of regaining your health and strength after being discharged from the hospital. A thoughtful routine ensures you stay on track with your care plan, reduce stress, and helps you make a steady progress toward your health goals. Here's how to build an effective recovery routine. First, we got to ask ourselves, why does it matter to have a recovery routine? Well, here are three reasons. A consistent schedule for medications, meals, and physical activity supports your body's natural healing process. In addition, keeping a routine helps you follow your care plan accurately, minimizing the risk of missed treatments or complications. Also, having structure provides a sense of control and reduces anxiety during a time of change. Let's continue discussing strategies to set yourself for success after discharge. Your body needs plenty of rest to heal. Prioritize sleep by setting a consistent bedtime and wake up time, aiming for 7 to 9 hours of rest each night. Create a comfortable sleeping environment by keeping your room quiet, dark, and cool. Balance your day with light activity and rest periods to avoid overexertion. And listen to your body if you feel the need to slow down. Other tips to help you sleep better are to avoid stimulants and electronics. Avoid caffeine, nicotine, and alcohol, especially in the late afternoon and evening. Caffeine can take up to 8 hours to wear off. Limit screen time before bed and try to avoid looking at your computer, smartphone, or TV for an hour before bed. Now let's talk about physical activity, an important part of your recovery. After leaving the hospital, staying active is a big part of your recovery. But don't worry, I'm not asking you to hit the gym tomorrow. The goal here is gentle movement to help your body heal and regain strength. Here are some tips to get started and find the right balance between activity and rest. If you've been less active recently, that's okay. Start with small, manageable activities like a 5 to 10-minute walk around your house or even light stretches. Movement helps improve circulation, boost your energy, and even lift your mood. The key is to listen to your body. If you're feeling tired, it's okay to rest. Recovery is all about progress, not perfection. Think about ways to include light physical activity into your day. Maybe it's walking to the mailbox, standing and stretching during TV breaks, or doing simple exercises like seated leg lifts. These little moments and movement add up and can make a big difference. Remember, rest is just as important as activity. If you feel like you've done too much or if your body needs a break, honor that. Healing happens when you balance movement with rest. One tip I love is to alternate active periods with rest periods. So, for example, try moving for 10 minutes, then resting for 20 minutes. It's all about finding what works best for you. Lastly, pay attention to how your body feels during and after activity. If you notice pain, dizziness, or shortness of breath, stop immediately and let your healthcare provider know. It's always better to play it safe. I want us to remember physical activity doesn't have to be complicated. A little movement each day can go a long way in supporting your recovery. Be patient with yourself, take it slow, and remember, you're stronger than you think. Let's keep moving forward with the next step to your recovery journey. Now, let's talk about one of the simplest yet most effective tools for a successful recovery, which is your daily check in. Taking a few moments each day to check in with yourself can make a huge difference in how smoothly your recovery goes. Let's break this down into 3 easy steps. Every day, take a moment to ask yourself, how am I feeling today? Think about your energy level and discomfort or new symptoms you might be noticing. Are you feeling better than yesterday? About the same? Or is something starting to feel off? This daily awareness helps you catch any changes early so you can act quickly if needed. Next, jot it all down. Keep a log or journal is a great way to stay organized. Write down things like your pain levels, how much sleep you're getting, your appetite, and any medications you've taken. You don't need to write a novel, just a few bullet points each day is enough. And if writing isn't your thing, you can use an app or even record a quick voice memo, whatever works best for you. If something doesn't feel right, like new symptoms, worsening pain, or if you're just unsure about something, don't wait. Reach out to your healthcare provider right away. Remember, your care team is there to support you and they want to know how you're doing. Early communication can prevent small issues from becoming big problems. Your daily check in is your way of staying in control of your recovery. By tracking your progress, reflecting on how you're feeling, and notifying your provider of any changes, you've given yourself the best chance for a smooth and healthy recovery. Remember, you've got this one day at a time. Let's move on to the next topic in your recovery journey. Now, let's talk about fueling your body for recovery. What you eat and drink plays a huge role in how well and how quickly you heal. Eating and drinking for healing isn't about strict rules, it's about making choices that support your body as it rebuilds and restores itself. So, let's break this down into three easy to follow steps. First and foremost, hydration is key. Water helps transport nutrients, flush out toxins, and keeps your energy levels up. Aim for 6 to 8 glasses of water a day unless your healthcare provider has recommended something different. Not a fan of plain water? No problem. Try herbal teas, infuse water with lemon or cucumber, or even little low sugar electrolyte drink if needed. Just be sure to limit sugary drinks and caffeine as they can dehydrate you. Next, let's talk about food. To give your body the building blocks it needs to heal, focus on nutrient rich foods like lean proteins. So think chicken, fish, beans, or tofu. They help repair tissues. Fruits and vegetables. These are packed with vitamins and antioxidants to reduce inflammation and support your immune system. Whole grains. They provide steady energy to keep you going throughout the day. And don't forget healthy fats like those in avocados, nuts, and olive oil. They're great for energy and help your body absorb nutrients. Sometimes after a hospital stay, your appetite might not be what it used to be, and that's okay. Eating smaller, more frequent meals can make it easier to get the nutrients you need without feeling overwhelmed. Try things like a smoothie, a handful of nuts with fruit, or a small bowl of soup. Simple, healing foods that are easy on your stomach. Remember, your body is working hard to heal, so give it the fuel it needs to do its job. Stay hydrated, choose healing foods, and eat in a way that feels good for you. You've got this, and every healthy bite you take is a step closer to feeling stronger and better. Let's move on to our next section of your recovery journey. All right, let's talk about something really important: knowing when to get help. Recovery isn't always a straight path, and sometimes things come up that need a little extra attention. Knowing what to watch for and when to reach out can make all the difference in your healing journey. Let's break this down into 3 steps. Your discharge instructions will include a list of symptoms to watch out for. These are often called red flags. Some common warning signs might include a fever, especially 1 over 100.4 degrees Fahrenheit, sometimes increased pain, swelling, or redness around an incision, trouble breathing, sudden or unusual symptoms like chest pain or confusion. Take a moment to review this list carefully and highlight anything that seems especially relevant to you. If you notice any of these red flags, don't wait, act quickly. It's a good idea to have important phone numbers in an easy to find spot like your fridge, your phone, or written in your recovery journal. These might include your primary care provider, your surgeon or specialist, a 24-hour nurse hotline, and of course 911 for emergencies. So make sure someone else in your household knows where to find these numbers too, just in case. If something doesn't feel right, even if it's not on your discharge instructions, trust your instincts. You know your body better than anyone else. It's always better to check in with your healthcare provider than to ignore a potential problem. When you call, be ready to describe your symptoms clearly and let them know if anything has gotten worse since your discharge. The more information you can provide, the better they can help you. As you recover at home, remember that you don't have to do it all on your own. There are so many community services and resources designed to support you, whether you need help with meals, transportation, home care, or just someone to point you in the right direction. Let me share a few trusted resources that can make a big difference during your recovery. If you're a senior or caring for one, the Elder Care Locator is a fantastic tool. It's a free service that connects you to local resources tailored for older adults. They can help you find things like an in-home care, meal programs, and transportation services. All you have to do is call 1 800 677 1116. That's 1 800 677 1116. Or you can visit their website at eldercare.acl.gov. That's eldercare.acl.gov. It's a great starting point to explore what's available in your area. Next up is United Way 211. This is a free, confidential helpline that connects you to a wide range of services, from housing assistance to food programs to mental health support. Just dial 211 on your phone and you'll be connected to someone who can help. It's available 24/7, so no matter what you need or when you need it, they're there to guide you. Sometimes faith based organizations like churches, mosques, or synagogues can also be incredible resources for support. Many offer free or low cost services like meal delivery, transportation, and even home visits for those recovering at home. You don't have to be a member to benefit. Most are happy to help anyone in the community who needs assistance. So don't hesitate to reach out to your local faith based groups to see what they offer. Your local health department is another valuable resource. They often provide free or low cost services like immunization, health screenings, and even home health resources. They're also a great place to find programs for managing chronic conditions like diabetes or heart disease, if that's something you're working on as part of your recovery. Congratulations! You made it through your discharge day guide. I hope this video has helped you feel more confident and prepared to take charge of your recovery at home. Let's quickly recap what we covered today. We talked about understanding your discharge instructions and medications, how to balance physical activity and rest, the importance of eating and drinking for healing, keeping track of your daily progress with check ins, knowing when to ask for help, and tapping into community services and resources to support you along the way. Each of these steps is designed to help you recover safely and smoothly, one day at a time. Remember, recovery is a journey, not a race. Be patient with yourself, celebrate small wins, and don't hesitate to reach out for support, whether it's from your healthcare team, family, friends, or the community resources we talked about. You've got this, and just know that I'll be here, cheering you on every step of the way. Thank you so much for spending the time with me. If you found this video helpful, please like, subscribe, and share with anyone who might need it. And don't forget to check out more of my videos here on Nurse Ally for tips on health, wellness, and recovery.